So lots of data going to be presented at EHA with regard to novel therapies, but also pitfalls in novel therapies with regard to MPNs. So in fact, there's a whole oral abstract session entitled Novel Therapies and Pitfalls in MPN. And in this session, we're looking both at different classes of agents alone, such as the MDM2 inhibitor KRT232. So there's a nice oral abstract presented by Catherine Haifa Al-Ali with regard to that agent. Then there is an oral presentation on Parsaclisib, which is a PI3K delta inhibitor. Again, being used second line in patients with myelofibrosis, for patients who have a suboptimal response to ruxolitinib. That is being presented by Abdul Rahim Yaqub. So Francesca Palandri and collaborators in Italy have managed to look at ruxolitinib and how ruxolitinib is stopped or its withdrawal in 232 myelofibrosis patients from Italy. And here she documents some of the symptomatology and problems that some of those patients are experiencing. So this is a nice and important abstract because it reminds people, as we are transitioning patients off ruxolitinib, perhaps to a period of no therapy or to another agent, that we do need to watch for symptoms of rebound of cytokines and rebound of symptoms and spleen size. So that's an important reminder for us. In addition, Naveen Pemeranju, he is presenting another novel agent, which is a CD123 targeted therapy in patients with myelofibrosis. He's presenting updated results from the phase 1/2 trial of Pagraxofusp. So that's one to watch out for. And then the last oral presentation actually comes from Florence Rafos, who's presenting data with the agent Mepolizumab, which is a monoclonal antibody in hypereosinophilic syndrome. So this is a phase 3 randomized placebo-controlled trial in hypereosinophilic syndrome of this antibody. So we all know that patients with hypereosinophilic syndrome can be difficult to manage, they can get tissue damage. So watch out for this presentation because it's really very nice. It's a novel agent for use in these patients. Otherwise, if you're interested in novel agents, there will also be updates with regard to Bemendemstat, which is the IMG 7289, which is the LSD1 inhibitor, still showing consistently strong message with regard to symptom and spleen improvement and good tolerability in patients with myelofibrosis. Also important is the data with the BET inhibitor from Constellation 0610. So there's a series of abstracts with regard to this agent, both as a monotherapy in combination with ruxolitinib for second line, and increasing data now from 60 patients from the JAK inhibitor naive patients. And this data will be taken forward also into a randomized study next year. Interestingly, this agent continues to be well tolerated, producing high levels of symptom and spleen responses, but also improvements in hemoglobin. So that's it with regard to therapies. I'm sure that there is data from a few other therapies, in particular focusing, for example, on interferon and Brasemi, the new ROPEG interferon, further data with regard to that, and also biological predictors of response, which can be important because, of course, this agent can be difficult to tolerate for some patients and is technically challenging for some patients to administer.